Well, you've likely heard about the virus trifecta hitting our area. It's closing schools. Even in some case, they're seeing impacts in hospitals. So to get an update on where we stand in our community and what you need to know about the viruses, we have UofL Health's Dr. Mark Burns here. Thank you so much for taking the time to come on today.
Well, thank you for having me.
Okay, so let's start with the hospitalizations. Are you seeing an impact on UofL Health facilities from these viruses?
There are increased number of hospitalizations. The COVID numbers are maybe slightly up just a little bit, but we are seeing a lot more as far as influenza goes.
Flu is really the one that is putting people in the hospital right now.
Usually for the older adults, yes, that is very true.
Okay, so there's always this conversation around the flu shot. And some people hesitant to get it, some people, not really thinking it's worth it because it has that 50% efficacy. What can you tell us about this year's flu shot and how it might be helpful?
So far from the information we have, the flu shot has been very effective. And as you indicated, about 50% efficacy, but that's truthfully about the average efficacy that you're going to see with flu shots in and of themselves.
And how does the flu shot help, even if you get the flu? I mean, is there some sort of protection? Does it lessen the impacts?
Yeah, because flu, like other viruses, it can mutate. And so even though the flu shot may not be specifically for that particular variant of the flu, it does help. And again, it doesn't necessarily prevent you from getting the flu, but it does help protect you. It arms your body, so to speak, with defenses in case you come in contact with influenza.
So we know, get the flu shot, good advice, get the COVID vaccine, good advice.
Absolutely.
What are the other things that you are telling patients right now, steps they can take at home with their families, out in public, to try to avoid these viruses?
Okay. Well, it's really the simple measures, such, for example, if you're sick, you should stay home. If you you actually should avoid people who are sick. If you are sick and you're coughing and sneezing, cover your mouth and nose. Make sure you wash your hands. The regular public health mitigating measures we had talked about before with social distancing. In addition, you can also take precautions of weaving and wearing a mask. That's recommended as well. And then finally, being vaccinated.
Okay, so the top things to keep in mind as we head into the holidays, we know everybody wants to be able to actually go to the holidays with their family.
Correct.
So good things to keep in mind. Dr. Burns, we always love having you on the 4 o'clock news. Thank you so much for coming in today.
Thank you so much for having me.